Hello, this is Dr. Munir Abbasi from the Daniyal Ultrasound Clinic. Today, we have got a really important and potentially life-threatening condition. The patient is suffering from the ruptured ectopic pregnancy. So, let us see how to define it and how to make a diagnosis. So, let's understand. Uh, it's really, I'm trying to use my simple medical language because many of the students and viewers complain that I should be using Urdu language as well as it should be so simple. So I will uh, utter a few words in Urdu at the end of the video, but let me define it first. So here, this is uterus again. I show you. Normally, what happens that the fertilized egg travels to the uterus and grows there. But in an ectopic pregnancy, the pregnancy implants outside the uterus, usually in the fallopian tubes. Fallopian tubes, they are really narrow and cannot stretch enough. So, as the pregnancy grows there, it may burst or rupture. So, what happens then when it ruptures? When the ectopic sac ruptures, the tube tears and internal bleeding begins. Blood collects in the pelvic and abdominal cavity. The patient develops severe abdominal pain, dizziness, and shock. So this is a true emergency. And here I would show you a few sonographic features so that people can understand who are interested how to diagnose it and how to reach how to get the typical findings. So on ultrasound, especially with the positive pregnancy test, uh, we can observe here. You see, here is the uterus. It's though showing slight amount of fluid inside, but this is not a gestational sac. This is a decidual reaction with the stromal edema showing fluid. The real pathology lies behind the uterus here. So there's no intrauterine sac inside the uterus. This, though it looks like that here, but it is not. It's not intrauterine sac. And here we have got this adnexal, right adnexal amorphous mass. It's a complex type of mass with a actually it is heterogeneous mass near the ovary or the in the area of the fallopian tubes. So still another finding. Let me show you here. This one. Here is the free fluid in the lower abdomen. You see here the free fluid. Hypoechogenic area. Here are the guts. This is right iliopsoas muscle. So this is the fluid, free fluid, or anechoic fluid. We can say that it is also found in the pelvis here, in the posterior cul-de-sac area, in the lower abdomen, even in the when it's in a copious amount. You can find it in the hemoperitoneal angle or in the inferior uh, borders of the liver. So here is also fluid found in the. You see here. Here it is. There's a thin streak of the free fluid in the hepatorenal angle and near the borders of the liver. So further, uh, actually this fluid is indicative of the hemoperitoneum or the blood. And sometimes you can find the sac in the area which has been ruptured, but so in most of the cases there isn't any sac, but an amorphous irregular mass is found. So even sometimes I have observed embryo, alive embryo, with the ruptured tube or the ovary, which I have also recorded in the previous lectures. So here only there's an amorphous mass which is occupying the posterior part and the right adnexal area. So these findings, along with the clinical correlation, point strongly towards the ruptured ectopic. Now, why it is dangerous? The question is, it is dangerous because internal bleeding can be rapid and severe, causing hypovolemic shock, organic failure, even death is not if the patient is not treated properly and urgently. So, this is a medical emergency, definitely, and laparotomy or laparoscopy is required. Now, clinical presentation, few I would like to share for my viewers that patient may present with severe lower abdominal pain, I told you, and shoulder tip pain sometimes is complained by the patient, fainting spells, vaginal bleeding, low blood pressure and high pulse, sudden collapse, and actually these symptoms should never be ignored, I tell you. So the final message is that a ruptured ectopic pregnancy is a life-threatening emergency. Ultrasound plays a key role in early diagnosis, which can save the patient's life. And if you encounter symptoms and suspect ectopic pregnancy, seek emergency medical care and immediately. So this was all from my side. Thank you. If you like this video, you please like, comment, share, and give me good advices as people used to do. I would definitely consider them, and this is really a special case here. So you see this is the right adnexal area which has been occupied by the amorphous mass. This is posteriorly check in a moderate amount, and lower abdominal fluid here, and uterus is though enlarged, showing deceleration with a copious amount of fluid in the cavity, resembling with the gestational sac, but it is not. So the case is indicative of ruptured ectopic pregnancy in the right adnexal area. Further, laparotomy, patient is to undergo laparotomy so as to save the life of the patient. Thank you very much.